Fortunately, we are seeing a spike in case counts from the coronavirus infection here and across the United States to record highs, likely caused by social gatherings that happened over Thanksgiving, on top of already high case counts. So this is an extremely dangerous period in this epidemic. I can't emphasize enough the importance of people following safety precautions now. Here are the numbers. Since this time yesterday, we've identified 1,408 new cases of the coronavirus infection in Philadelphia residents by the PCR test, the regular test, bringing us to a total of 75,458 since the beginning of the epidemic. And in addition, 108 new probable cases diagnosed by the rapid antigen test. Now, we're having delays in laboratory reporting results to us, and it makes it difficult for us to follow the trends in the epidemic. But the pattern we're seeing is clearly a decrease in the number of cases daily before Thanksgiving, followed by a sharp increase after Thanksgiving. So let me give you a sense by looking at the past 3 weeks. For the past week, November 29th through December 5th, we averaged 910 cases per day so far, but we expect more to be reported in the future. And of the people tested last week, 12.7% tested positive. Now, the previous week, November 22nd to November 28th, we averaged 820 cases per day, and 10.6% of the people tested positive. And the week before that, November 15th and November 21st, we averaged 951 cases per day and 11.1% tested positive. So you can see the cases were falling until late last week, and then there was a sudden increase. Now, while the increase in cases in Philadelphia was big, the spike was even bigger elsewhere. In Pennsylvania as a whole, they were reporting some 5,000 and 8,000 cases per day through the end of November. Then on November 3rd and 4th, they reported more than 12,000 cases each day. In the United States as a whole, it is now hit an all-time high of more than 200,000 cases in single days late last week. Why are we seeing this big increase? Well, the answer is Thanksgiving. The spike in cases happened suddenly in most states in the United States at the same time. And the cases started about 5 days after Thanksgiving, which is the typical length and incubation period for the coronavirus. And then we have plenty of stories from our case interviews of people that got together or Thanksgiving gatherings. So here's one, for example. There's a woman named Maria. That's not her real name, but the purpose of this, Maria. It's a woman in her 20s. She had symptoms the day before Thanksgiving. She gathered with 10 family members on Thanksgiving anyway. And after Thanksgiving, she went in and got tested, and she tested positive. Shortly thereafter, her family members started developing symptoms. And at this point, at least 7 others at that gathering have already tested positive. Stories like that happen across the city, across the state, and across the nation. Now, back here in Philadelphia, what's happening in nursing homes? We're continuing to see clusters of cases in them. For the weeks of November 15th and November 22nd, we were at more than 160 cases each. Now, that's not as high as we saw in the spring, where we saw more than 700 cases in a single week. But the big increase from the 10 to 15 cases per week we saw in the summertime. And we now have 50 nursing home residents with COVID in our COVID relief unit, where they're in part to protect the other residents in the nursing homes where they got their infection. What about our city's hospitals? Well, the number of people hospitalized with COVID is still growing in the state of Pennsylvania and Philadelphia. The state of Pennsylvania as a whole is growing very rapidly. There were more than 5,400 patients with COVID in hospitals yesterday. 2 weeks ago, that was 3,400, so risen more than 2,000 in just 2 weeks. And 5,400 is nearly twice as high as the peak of 2,800 saw last spring. Back here in Philadelphia, there were 886 patients hospitalized with COVID this morning. That's an increase of about 200 from 2 weeks ago. And the hospitals are clearly showing signs of strain. Now, they have enough beds, but they're having difficulty maintaining staffing. In the past 2 weeks, the epidemic has been worst in the northeast section of Philadelphia, so the hospitals in that area have been particularly hard hit. Hospitals are talking to each other, and they'll be moving patients around as necessary, even the load. What about deaths? Well, unfortunately, I have to report that since yesterday, we've identified 52 deaths from the coronavirus among Philadelphia residents, bringing us to a total of 2,107 since the beginning of the epidemic. Now, our data from deaths is typically delayed, and it often comes in batches like that. But overall, there's clearly a sharply rising trend. For the week of November 15th, there were 47 deaths so far. The week of November 22nd, there were 65 deaths so far, but we expect more. This is a big increase from the 10 deaths per week we saw in September. We're on track to have several hundred more deaths before the end of the year. What about testing? Well, with increased demand through testing, our testing sites are busy. Appointments are difficult to get at some of our sites, and the laboratories are backed up. And so to a certain extent, there are delays in getting test results. On average, maybe 3 to 4 days. At some laboratories, people get the results instead of 1 to 2 days. There's some people we've heard that have gotten the results back as late as 7 days after they were tested. So during this time when it may be difficult for people to get tested, it's important for people to remember the priorities. It's most important for people to be tested if they have symptoms or if they've been exposed to COVID. For others, remember, testing is not a substitute for wearing masks and keeping distance from other people. Because if you test positive, you need to wear a mask and stay away from others. And if you test negative, you need to wear a mask and stay away from others. Testing is not a substitute for mask and distance. Now, as the mayor mentioned, there are now new recommendations from the Centers for Disease Control on the quarantine period. Previously, if you're exposed to someone with COVID, the recommendation was to quarantine for 14 days after the last exposure. With the new guidance, if you're exposed, you should quarantine for 10 days after the last exposure. Or there's an option that you can end a quarantine after 7 days if you have a negative test. That test can be no more than 48 days old. The rationale here is that there are very few people will turn positive after more than 10 days since exposure. Some, but not many. And if the quarantine period is shorter, 10 days instead of 14, we hope that more people will stick with it. Philadelphia will follow this CDC guidance, and our shortened summary of it is posted on our website. Now, overall, we hit some pretty grim milestones last week. So it's worth thinking how severe this epidemic has been in the city. We now have more than 75,000 people who've been infected with this virus, nearly 10,000 people who've been hospitalized, and more than 2,000 people who have died just in 9 months. The epidemic has touched us all. Everyone knows someone who's been infected. About half of Philadelphia residents know someone who's been hospitalized, and it's very common for Philadelphia residents to know someone who has died. Unfortunately, even though it's been 9 months, the epidemic is not in the past yet, not at all. Most people in Philadelphia are still susceptible to this virus, still susceptible to this infection. There are still many more people who could get infected, who could become hospitalized, and who could die if we don't prevent the virus from spreading. Now, we have more holidays coming up. And in the past holiday, I believe most people followed our recommendations to not have large family gatherings, but too many people didn't. And we can't afford to have more case spikes like this Thanksgiving spike. We just can't afford to do that. Which brings us to our restrictions. Our safer at home restrictions rules went into effect on November 20th. They are in effect at least through January 1st. Remind people that means no indoor gatherings, no indoor gatherings, no indoor dining, no indoor sports, no indoor gyms, museums, or libraries. And for retail stores, people are required to wear masks, and there's a limit on the number of people in the store of no more than 5 per 1,000 square feet. Detailed guidance for all different settings that we have guidance for is at our website, www.phila.gov/saferathome. I believe these restrictions prevented the increase we saw last week from being even worse. So we're asking everyone to take them seriously, to follow the rules and follow the recommendations. Now, let me end on a little more hopeful note about vaccination. The FDA is reviewing results of the studies of these 2 vaccines right now. And they apparently just released evidence of one of the trials this morning. I've not had a chance to review it yet, but I'm hopeful about that. If that first vaccine, that's the vaccine produced by the Pfizer company, if it's approved later this week, we are likely to start offering that vaccine here in Philadelphia next week. And the second vaccine coming down the pike, Moderna vaccine, could possibly be approved a week later. And if so, then we may start vaccinating with that the following week. And with both of these vaccines, we will have limited doses. And our first priority group is going to be healthcare workers who are routinely exposed to coronavirus. And we'll widen the group that gets vaccine as more vaccine becomes available in the coming weeks and months.